Sultan received you. Regarding Almighty Allah and Mustafa sallallahu alaihi wasallam, now is the day of reckoning. Today, لا يؤخذ منكم فدية ولا من الذين كفروا. It will not be taken any compensation and ransom, nor from the munafiqeen and hypocrites, nor from the non-Muslims. Your last resting place forever is Jahannam and the hellfire. Allahumma ajirna min an-nar. Ya mawlakum, that is your helper, that is your protector. Allah is mocking them. There is no helper and protector. Wa bi'sal masir. What a horrible, terrible place to return to. May Almighty Allah grant us Jannatul Firdaus al-A'la and protect us from nifaq and hypocrisy. Next up, once again,
oh, in the front. Okay, it's actually at the back. Yeah, it's okay. Don't worry, it'll be there now. No, I didn't say that.
I said exit the back. Exit.
3 to 3:40 will be today's morning's repeat Q&A, then du'as, then 4 to 5 will be Maulana Salim Dorat, inshallah, and then 5 to 7 will be Maulana Ali Yaqub, and 7 to 7:30 the tafsir now, Surah Hadith, verses 10 to 15, 7:30 to 8 more Yunus Patel, Rahimahullah's advices, and then 10 to 12, inshallah, the Q&A we had on Sunday.
Call Shida and tell her 10 minutes.
Tonight, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Yeah, but that's like what you like call it 10-15 minutes to stand there.
For the full range of car audio, our TV department carries
that doesn't
top
make a
brands
difference.
with
She's not
quality
gonna
LED panels, full HD or Ultra HD, and now the experience of Super Ultra HD. Visit our
You forget that you said front.
I said back.
Mommy said
exit, Mom.
exit actually, and I think
Exit.
she said it in a way that I thought you'd misunderstand, but then again, she said exit being car exit.
So where did you want me to meet you?
At the back.
Car
Where
exit.
we usually with the cars.
But that doesn't make sense. That's making me go
Making
away.
you go differently, not more.
but
It's actually
I-
the same distance.
Same.
But the problem is you misunderstood it. Understandable. Mommy wasn't very clear. Exit is actually not inside, but it's fine. Outside.
I even repeated.
Yeah, she misunderstood.
That it is the one designed for software and the software is the one who makes the hardware. So what is the intent of these creatures and what's really created?
Actually, she does it home today. She sees them.
They become say very young as Allah subhanahu wa ta'ala says.
Oh, where are we fetching Shida? From a house or the shop?
I think let's call it.
Remember what happened to her mom?
Yeah, no, the guy said he's still busy.
What's wrong?
What got stolen? No, it's the first one.
What are you saying?
The car got broken into, not stolen.
That's what I'm referring to.
Yeah, Daddy didn't make it. It's terrible. She can't keep a car that way. Unless she finds a secure parking.
Open 7 days a week. Follow us on Instagram at Turkey_Dublin or call 08378.
Good afternoon, everyone, and welcome to our Module 5 Human Resources for Health session today. My name is Mercy Wanjala. I'm a family physician from Kenya, and I'm the Deputy Executive Coordinator for Afro-PHC. And I will be facilitating this session. We have with us Nabufo Francois, who is the Deputy President for Afro-PHC, also joining us today. I don't know if Abolade Fumilola is on the call. Fumilola, have you joined? Sorry, she has not joined. So I am going to be taking you through Module 5 today, and not all of module 5. It has about 5 units and it was quite bulky. So what I'm going to do today is I'm just going to take you through a few of the concepts within module 5, which I find very important for anyone who is managing human resources, anyone who is part of human resources and would like to make it better from a leadership perspective. So can you see my screen? You can just raise your hand or unmute and just say, yes, I can see your screen.
Yes, you can see. Thank you.
Thank you.
Yes, we
Thank you
can.
very much. All right, let's go ahead. So,
Yes, it is clear.
thank you. So this was the intention of module 5, such that by the end of the module, you are supposed to be able to outline the evolution and context of human resources for health, apply human resource policies in healthcare management for those in management, then effectively plan for human resources for health, perform the functions of human resources for health in health service delivery, and finally monitor and evaluate effectiveness of human resources for health. So hopefully, for those who have gone through the module or those who will go through it after this class, you'll be able to do this by the end of the module. So if you haven't gone through it, you still have time. You can go through the module after the class. We have a Google group. You can always post your questions there or your concerns there, and they can be picked up and we can have discussion. So the units that were there were 6 units dealing with the various objectives that I've just mentioned. And I hope you'll be able to go through all the units because they have, it's a lot actually. I think sometimes for me, it took me like 1 week, 2 weeks to go through all the content. So it's a lot of content. So just go through it slowly so that you can, whatever you don't understand, post on the Google group. So what is the concept of human resources for health? So the definition for the human resources for health has actually been evolving over the years. It started in 2006 with WHO saying it refers to all the people engaged in all actions whose primary intent is to enhance health, or the stock of individuals engaged in the promotion, protection, or improvement of population health. But then people started asking in this definition things like a mom who's taking care of her children in the home, a community healthcare volunteer, or a community health worker, are they part of human resources for health? So it evolved and they started saying it's human resources for health are either technical or support people, and they can be technical staff, including clinicians and nurses, while support staff can be the ambulance driver, the hospital finance manager, the hospital store manager. All those people are considered human resource for health, because lots of time people think human resource for health is only the doctors and the nurses and anyone else working within the clinical context. But you find that anyone, no matter where they work, as long as what they're doing touches directly on enhancing population health, they are considered human resources for health. Then in 2009, it evolved to include all health and non-health vocational education and training working in the health services industry. So anyone with any kind of training who is working in the healthcare industry, doesn't matter what their training is, even if it is in IT, they are considered human resources for health. Then finally, in 2010, the definition evolved to include all categories of health workers, from specialists, physicians, and surgeons through to community healthcare workers. So you see there, they actually acknowledged community healthcare workers, because everyone kept saying community healthcare workers are supporting primary healthcare workers on the ground at the community level with families. So then why are they not considered when you're considering human resources for health? Because when you plan and you plan for budget for everyone who is considered under HRH. So if you do not consider community healthcare workers under HRH, then you will miss them when you come to budgeting, planning, deploying, and all that. So those are the concepts, and this is where we are in terms of defining human resources for health. So I hope that is now clear. Anyone with any kind of vocational educational training who directly supports the development of population health, whether as a technical person or a support person, all those people are considered human resources for health. So we come again to another concept that is important for us to understand in this module, which is human resource management. What is it exactly? And just like the definition for human resources for health, also the definition for human resource management has been evolving. And it started as being defined as a distinctive approach to employment management that seeks to achieve competitive advantage through strategic deployment of a highly committed and capable workforce using an array of cultural, structural, and personal techniques. So that is from a business perspective for those who've done business administration. So from a business perspective, this is how HRM was defined. And that's why you find a lot of documents, HR policy documents nowadays have the definition of a highly skilled, motivated, committed, and capable workforce. So this is where that definition actually comes from. And in 2004, Buchanan and Huzinski defined HRM as a managerial perspective that argues the need to establish an integrated series of personnel policies to support organizational strategy. So from them, they did not look at it from the perspective of just the workforce and looked at it in terms of policy. So any kind of policy, any kind of statutes that we need to support an organization strategy, that is HR management. Then in 2007, Bradford and Gold came and say that it's a strategic approach to managing employment relation that emphasizing leveraging people's capabilities is critical to achieving competitive advantage, this being achieved through a distinctive set of integrated employment policies, programs, and practices. So as you can see, the key concepts here that are being mentioned is 1, strategy, 2, organizational, supporting that organizational strategy, 3, the workforce being committed, capable. Another thing that is being mentioned is competitive advantage. Another thing that is being mentioned is policies, programs, practices. So whenever you're thinking about human resource management, those are the concepts and the words that should come to your mind. You don't have to have like just a one word by word definition. You just need to understand the concept. So coming down to why HRH is very important and has become a very hot topic is because of the global HRH crisis that was reported from 2004, formally reported. It had been there before, but formally there was a report that was written, and there seemed to be a crisis, with the crisis mostly affecting countries in sub-Saharan Africa, where there's a severe shortage of healthcare workers or human resources for health. So the 3 major crises, and you can attest to this even from where you work, is 1, coverage. How many do we have and where are they? 2, the work environment within which healthcare workers have to work. That's why the words motivation, capability, commitment comes in. You know, what kind of work environment are they working in? And the work environment was found to be wanting and therefore creating a crisis. And 3, competencies. How competent are the people working within our healthcare sector? Do they have the necessary knowledge and skills? Because you can have people, but then depending on their knowledge and skills, you might have 50 people doing something that 25 can do with the right knowledge and skills. So all these 3 major things are what is contributing to our global HRH crisis. So coming down to important concepts, one of the things that I would like us to take home from this module is the HRH action framework. I'm sure a lot of you have seen this in your work, especially those who work in management and who work in development of policy. This HRH action framework is being used globally by countries all over in determining how do we come up with HRH policies, statutes, procedures that work. And this HRH action framework, to deal with what we've just seen, the global HRH crisis, has 5 things that are quite important. 1 is leadership. And we've already gone through the leadership module. and seen how important leadership is, especially in determining the kind of work environment people are going to work in determining the motivation and engagement of workers. Policy, because policy determines what we do. Policy determines where resources go. And then finance, we cannot do anything without money. If you need to hire people, if you need to motivate them, if you need to build a good work environment, all those things take money. The other thing is education and partnership. So all these things come together to help us develop policies and strategies within our organizations that help to support human resources for health. And an important thing or a cycle that goes on as you're trying to create action to deal with the HRH crisis is, one, you do a situation analysis around these things. How is my leadership? How is policy? What does policy say? How much money do we have? How much money do we need? In terms of education, is it enough? Do we need more? Which people do we need to partner with? Especially nowadays, something that is gaining traction is private-public partnership. How can private organizations partner better with public institutions to ensure that human resources for health is well distributed, there is good coverage, there's a better working environment? So how do we work together with other people? So once you've done a situation analysis, you come to planning, then implementation, then monitoring and evaluation. So the whole goal of this HRH action framework is, one, to improve the health workforce and to improve health services. Those are the two main outcomes in terms of equity, effectiveness, efficiency, and quality, which at the end of the day is just providing quality healthcare services, especially if you look at the STEEP model that defines quality healthcare. So at the end of the day, we all want better health outcomes. So two things which I want you to note in this framework is the words country-specific context, including labor markets, because you will find that one thing works for the labor market in your country, but does not work for the labor market in another. For example, you have some countries where we have community healthcare workers who are paid, they have a salary. You have other countries that work with community health volunteers who are given a stipend, depending on who the community health volunteers are and the community health workers are. So they are different people in different contexts. So depending on your context, how does this work? How will this policy, how will this plan work for me in my context? Because we usually find a tendency where we go and take an HRH policy from maybe a developed country, we bring it to our country, and then it doesn't work. For example, there are places where hospitals have daycares. Some of them even have schools for the children of the healthcare workers to go to, so that they are close to their parents and such things. But then you come to Africa and you're like, okay, that is not going to work in my context because of this and this and this. So you have to think of something else, of motivating your healthcare workers or making the environment more suitable for them and their families so that you can keep them at work. So that is the HRH action framework, and I'd like you to go to, it's in, I think, unit 3, and look at it more in detail. Then the other thing that is very important in this module is the workload indicators of staffing need. So I think a number of you might have heard about this, especially those who work within the policy sector, because this was a tool that was developed by the WHO to help countries do their HRH planning better. And according to this, I usually call it WISEN, because it's a wise way of, planning your human resources. And it's a management tool that provides health managers with a systematic way of making staffing decisions in order to manage the valuable resource effectively. So I'd encourage you to go to the WHO website, look for WISEN, Workload Indicators of Staffing Need. There's a very good instruction manual on there how you use it, because it looks at who are the healthcare workers that you need. Do we need nurses? Do we need doctors? Do we need more clinical officers? Do we need more surgeons? Who do we need? And then how many do we need? And then how long do they work? Like a typical nurse on a typical day over 6 hours? How many patients does she manage over 6 hours? Or how many patients humanly possible can she manage over 6 hours? So it helps you even plan your shifts. You say, I need 14 nurses. They'll be doing 6-hour shifts every day. And then after they do their 6-hour shifts, maybe they get, those who do nights will get maybe 12 hours or 18 hours or 24 hours off before they come up for the next shift. So it helps you make all those decisions. So it's a very important tool when it comes to HR management in the health sector. Then another important thing that we should look into, and it's often ignored, especially in the healthcare sector, is the management, that's supposed to be management, not management functions of HR. So there are 3 major functions of HR. There are others, but these are the 3 major ones. And one is resourcing, and resourcing is in recruitment and selection, training and development, then retention. So in terms of recruitment and selection, normally what's supposed to happen is you're supposed to have a plan, and you're supposed to have requirements and qualifications for the person that you need. But nowadays, moving away from the tradition of saying, I need a nurse with a diploma and they have to be able to see patients and all that, the private healthcare organizations are actually even moving towards doing personality tests, doing attention tests, doing your tests that check your, maybe even your finger dexterity, they check your attention to detail. So it becomes actually a series and a step-by-step. It's no longer the old traditional way of, I just put up an advertisement that I need this kind of healthcare workers, I need this kind of people to work in my hospital or to work within the district, and they need to have this qualification. So now they even have steps for the interview processes, and I think some of you have even gone through them. And this has actually been shown to increase the quality of services that are given to patients, because once you have someone with the right qualification, yes, this doctor has done an MBCHB and is qualified, but then you test, how good is this doctor when it comes to attention to detail? How good are they, how are their surgical skills? How is their thinking? How is their critical thinking? So all those tests are nowadays being applied in the recruitment and selection process, so as to ensure you get the right person for the organization. So on the left of the screen, you can see the steps that you're supposed to take when you are hiring someone for your hospital, for your organization. And I'd have to ask, by a show of hands, how many actually follow these procedures or how many in your organization, in your country? Is this usually the process that is followed when you're hiring? Just by a show of hands. Let me see. Just put up your hand if you usually follow this procedure. I can't see any hands. I think that means, oh, I can see one hand. 2. Yeah, 3. So yeah, so a couple of people actually follow this procedure. So it's important to follow this procedure, especially because you want to get the very right people for your organization. You just don't want to get people who are qualified on paper. So the recruitment and selection process is actually one of the most important processes that we always miss, especially in the healthcare sector, because we assume everyone who has a certificate and shows they are qualified for a certain job, then they're qualified, especially in the public sector. So we just put out the advertisement and pick anybody. We don't have really a way of selecting the best for a certain job, because a nurse might be a very good nurse in the ICU, but not very good in the emergency department, or very good in labor department, but not very good in, outpatient department. So those things have to be considered when you're doing recruitment and selection, because it is one of the most important processes of getting the right people for the organization. They even go ahead to talk about organizational and individual match. Sometimes the person might be the best person on paper, but when it comes to the culture of your organization, then they don't fit. So there's the issue also of cultural fit when you're doing the recruitment and selection. How well does this person fit within the values for which this organization stands for? Because you find there are hospitals that are started by religious organizations, And some of these religious organizations usually want the staff to abide by the values which they believe in or they actually portray to the community. So you might find a person looks good on paper, but will they fit culturally with the rest of the team? Because remember, again, one thing we are really promoting, especially at the primary healthcare level, is teamwork. So when you're selecting and recruiting this person, will this person fit with the team? Because if they cannot fit with the team, they might be the best qualified person, but you realize during the recruitment and selection process that they don't fit with the rest of the team. So it's important to consider all these things if you're in the position where you are the one doing the hiring and recruitment and selection process. Then we will also look later on the slides at training and development and the concept of retention. Because I know especially training and development when it comes to the healthcare sector is something that managers really grapple with. You know, whenever you're sent those memos from the director of health or the National Health Office, and they say, do a training needs assessment and send it to me. So how well do you do it? What's the procedure? How are you supposed to do it? That is something people grapple with. And then the issue of retention. Because when I mentioned earlier on the global HRH crisis, one of the biggest crises is retention. And with migration of healthcare workers and other allied health professionals, not just within the country, also outside the country. And you find even right now, a lot of developed nations recruit a major chunk of their workforce from underdeveloped nations or the developing nations. So retention becomes a very crucial thing when you come to think about functions of HR. How do I keep my people? So next slide, sorry. So when it comes to HRH retention and retention strategies, work environment has become actually one of the major factors that determines whether people stay or people go. And a lot of you can attest to that. Because right now, a lot of people will tell you, why don't you come early? Why don't you do what you're supposed to do? You find that they are demotivated. Demotivation has become an issue. So how do you create a work environment that will keep people? So the work environment has to be rewarding, has to be challenging and satisfying. That's the work they're doing. It has to be a safe and secure environment. We've had a lot of issues with health workers being attacked, you know, by relatives who are angry for one reason or the other. An environment that keeps the worker focused and proactive, an environment that is fair. Don't promote one person over the other when you know the other one deserves it more. Equitable. How do you treat your people? Do you favor others over the rest for one reason or the other? And legislative complaint, the legislative compliant. That means if the labor laws don't pay someone below this, don't pay people below that. So you have to have an environment that is legislative compliant. As I draw to a conclusion, another concept that you should really look into and keep in mind when it comes to HRH is performance management. How do you tell who does what and how well they do it? It has to be something that is very objective. And these are the objectives of performance management. And there's a traditional feedback system, which you are moving away from, where the supervisor talks to the supervisee and that's it. We are now moving to what is called the 360 feedback, where it's not just the supervisor talking to you and telling you, no, you're not doing your work well. It is the 360. That means your co-workers, external customers, everyone who you are interacting with in your job actually gives you feedback and you give them feedback. That's the 360 feedback that we're looking for in performance management. And that is just a look to show you performance, how you're supposed to do performance management. You have, first of all, to plan. You have to do coaching and mentoring, which includes things like induction. When someone comes, you have to do an induction for them, a training to show them what they're supposed to do within that organization. And then you're supposed to mentor and coach. Where they're weak, you're supposed to tell them you're weak in this area and I can show you how to do it. You don't just come and you're telling someone every day, you're doing very terrible work, and you don't even say what that terrible work is, and you don't tell them how to improve. We are moving away from that to coaching and mentoring, then measurement and evaluation. How are you measuring how well I'm doing my work? Is it through customer feedback? Is it through patient feedback, patient experience? You know, how are you measuring my performance? It has to be very objective. It has to be clear to both the leader and the supervisor and the worker who they're supervising. It has to be very clear. And then there has to be feedback with documentation of that feedback. If you call someone to your office to tell them they're coming late, they're doing their job poorly, first of all, there has to be set standards which were communicated earlier and even written and signed, so that when you're saying that, you actually have a basis for what you're saying. And then you have to have evidence that what you're doing is wrong or what you're doing is not right. And then from there, you have to have a way of improving or a way forward. And that has to have feedback and both documentation. That's performance management. And then there's a very important concept called management by objectives. So everything you do as an HR manager, as a nursing manager, as a medical officer in charge of a place, make sure everything you do is by objective. It's called the MBO method, where you set objectives, and those objectives have to be clear with every employee. You're working in the outpatient department. The objective there is 1, 2, 3, 4, 5, so that the organization can do 1, 2, 3, 4, 5. Then you monitor, you do an M&D, then you reward performance. So once you set your objectives, you have to say, if someone is able to meet these objectives, what am I going to do for them? Is it going to be a promotion? Is it going to be a gift? Is it going to be recognition as employee of the month? Those things have to be very clear. On the right of the screen, it just shows you ways in which you can do your monitoring and evaluation. You can do it financially, you can do it through customers, you can do it through the processes which are being done in your organization, and you can do it through a learning and growth system. So when it comes to training and development, I am finishing up now. There's a desired level of performance, and you have to set that very clearly and say, in this hospital, this is what we want to do. This is how we want nurses, doctors, etc. to work and behave. Then you have to now know what is your current level of performance. Now, the difference between your desired level of performance and current level of performance, that is where your training needs assessment comes in, and training needs gap comes in. So that's your performance gap, and that is what you need to address. And how do you address it? One, we've mentioned induction and orientation, education, then training and development. And here I've put this here because it's very important for you to have that distinction between training and development. I mean, training and education. Education is more long-term, preparing for someone's future job, like what we do in undergraduate, postgraduate training that people come to work. But training is now for the current job, helping, and it helps to address poor performance. So don't use training as a way of preparing someone for a future job. No, you do use training in order to address these training needs and the performance gap. Use education to make sure when this person comes into the organization, they are prepared for that job. But now when it comes to the current job, to make sure they do the right thing, you do training. Short term, and it is meant to address those gaps and needs that you have seen, and no minimum academic qualifications are required. Then there are some methods of on-the-job training which are usually overlooked. That is mentoring, coaching, job rotation, and apprenticeship. These are 4 things which are really lacking, especially in the healthcare sector, because 1, we are understaffed, we are stressed, we are overloaded, we are overworking, so nobody is there to do mentorship, nobody is able to do coaching. When you're told to do job rotations, it even becomes job rotations. I think we do it more than we do mentoring and coaching. But then apprenticeship, remember in the healthcare sector, everything is apprenticeship. How will I learn how to inject a patient or fix a fracture if I'm not shown? That is apprenticeship. And remember that I cannot teach you how to treat a patient through my screen right now. That will not be effective. So apprenticeship becomes one of the cornerstones of OJT in the healthcare sector. So other ways in which you can do it is through simulation exercises, lectures, role playing, which works very well, case studies, and what is called an in-basket method, where you use mails, memos, minutes, and which are printed and placed in a tray basket, and then the trainee comes and just picks a random document for that day and reads it, and then has to make a decision depending on what that document says. So that is an on the job training. Then we have career development, which is very important, just to mention that it is about the organization as well as the individual. If someone does not see where their career is going, even in the healthcare sector, then they're unlikely to be motivated to work. So that is something that you have to really think about when you're bringing someone on board an organization. Then monitoring and evaluation, that is something also important to do in HR management. We have talked about the issue of desired level of performance, current level of performance. So everything that you're doing, from the recruitment and selection, training and development, retention, and when even let someone go, you're supposed to do a monitoring and evaluation of all your processes. How is our recruitment and selection working? You have to have how you measure that. Then how do you evaluate? How often do you evaluate? Do you do it quarterly? Do you do it yearly? But you have to evaluate your HR processes, not just your workers, also your HR processes, not just the employees. How well are you doing? Also for you, when it comes to how you're managing the employees, how well are you doing? And a lot of healthcare managers don't do that, but it is something very important for us to do. And with that, I come to the close of that, and I open up the floor for some questions before we move to our breakout groups for case discussion. So I've seen Amin. Amin, you've raised your hand. You can just unmute and raise the question. Are you able to unmute? Go ahead. Amin, I don't know, I can't hear you. Ah, sorry. Okay, anyone else?
Good afternoon, everyone.
Good afternoon.
Yes, Mercy. Sorry, I joined late, but I was able to acquire as much knowledge as possible. It's a positive thing, and I wish if this can be encouraged, because there's a gap and there's a big challenge, especially in the health sector. Most of the guys are just basically trained in the human resource general. So you find that when you come to the healthcare system, majority of the training, this is from my personal interaction with most of the HR within the healthcare sector, you find there's a lot of gap based on their training and the actual work in terms of hands-on skills. So the so-called performance based objective, most of the time you look at even the structure of every company within the healthcare system is not clear on the areas or the key performance indicators develop, unless they rely on the management. Like they'll tell you, go to your supervisor to develop for you KPIs. Yet this is an HR docket. So I think such kind of session should be maybe perhaps encouraged, or I don't know whether it's based on the curriculum, that the curriculum generally just target, you want to be trained as an HR, and then where the job place you in an hospital, place you maybe in an NGO somewhere which does not involve the health system or health services. That's what I've noticed. But I think, yes, I've learned a lot.
Thank you very much, Edwin. I think that is very true, because human resource needs to be tailored towards the sector. And I think that's why this training is so important. And I'm glad you're finding it helpful. Jackie?
Okay, I wanted to respond to what Moses was saying. Yeah, it's true there is a gap as far as human resources is concerned. We know it is like in Kenya, it is something that is in the recent past has become very popular and getting enshrined into most of the institutions. So you find that there's a challenge as far as their performance is concerned, especially when you consider that the HR people are not okay, they are not, for example, in the health sector. In the health sector, we have clinicians and we have our own complex issues, specialized issues, which need specialized attention. So you find that these people are not able to comprehend. In fact, if you look at the qualifications of maybe the HR departments, there are people maybe who worked, okay, from the context of where I come from, there are people who are working as this, maybe they got a D-, they went for a diploma, they went for a degree, they are now HR and what. So sometimes comprehension and understanding of those things is not okay. So it gives a big challenge to the organization. And then so I agree with you that maybe some of the challenges is as people who are technical people be able to come up strongly and support the performances of our specialized different sectors. But there comes now the challenge. You find that they say, a whole doctor, it is so expensive training a whole doctor to come and do the HR work, but why not? Why shouldn't we as specialized people take up the responsibility of trying to improve the services that we have? So anyway, it's debatable, but that is what I think myself.
Yeah,
And
thank
sorry,
you so
just
much.
a quick one. Just a quick one, Mercy. In addition, why we are saying this, because these are challenges we face, especially when it comes to reward. The HR are not able to understand the nature of our job and how to reward us. But now my question is, recently I saw in the area of procurement that actually there are some courses now tailored, like you can do procurement and then you do procurement and logistic in healthcare system. I don't know, when it comes to HR training, is there a curriculum where you can basically be trained as an HR, but specializing in HR in the healthcare sector, not just general HR, and then you come to the healthcare.
Sorry, Moses, I think we've lost you.
Which you want to fit in the healthcare, but cannot fit because the training is not fitting.
All right, yeah, I do understand your frustration actually. And lately they're developing HRH courses.
Yes.
I don't know whether they have added them to the general HRH curriculums, but there's always that option to do training in human resources for health. I've seen a couple of those trainings online. And in some universities, there are universities which are offering training in human resources for health, which I think is a step in the right direction. And I think also courses like this one that offer training for managers, specifically for human resources for health, I think are also very important, a step in the right direction. Now it's just a matter of making sure as many people as possible who are involved in the healthcare sector get to know about these courses and get to do them. And I know a lot of people who are here have worked as healthcare managers or are working as healthcare managers. So it's also important for the people, technical people like Jackie mentioned, to be aware of these policies and actually how to handle human resources for health. I think it was Abe who had raised his hand, then we'll go to Mungabo. Is it Abe or Abe? You know, you might have said Abe and it's Abe. Abe Peter?
Yes.
Peter Nassan? Yes, go ahead. Abe, sorry.
Yeah, the issues regarding human resource managers in our facility, most of them for sure are people who are in their training, they were not intending to come into the health service provision sector, but they found themselves by the virtue of finding a vacancy there and being pushed there. They found themselves working in that situation. But I've said there are courses which are going on. I think it is now our responsibilities to challenge our ministries, to challenge our organizations to at least push these people to go for specific courses in regards to health service provision. I think that one will improve. Indeed, it is generally, I think in Africa, this is our problem because most of these things, I think, are just coming of late. We are getting into those specialties and those things are coming out like that. But so this is the right time. I think we have to now try to project the problems that are coming in relations to the workforce we have, like the nature of human resource managers who have been with us are traditional. Most of them are traditional because what their course entail is general human resource management, but not specific to health service provision. So this one now will call for our constant remarks to the health service providers like the Ministry of Health and other organizations to at least now look into that direction of training or looking for human resource managers who are specifically who had some additional training in health service management to solve our problem. Thank you.
Thank you, Abe. We are going to have one more comment from Mungabo. And before that, if there's anyone who is French speaking, we have a French interpreter and interpretation available. Just go to the bottom of your screen and click on interpretation, and then you can click French or English depending on your needs. I'm sorry about that earlier. I'd forgotten to set up the interpretation, but it is now available. And if there's anyone who would prefer to go to a French speaking group, also please feel free to put F after your name, and I will specifically place you in a French speaking group for discussion. So I'm just going to take a short comment from Mungabo, and then we will break out into our groups. Prof. Shabir had added the case onto the chat, but I will upload the case onto the chat for those who do not have it. Go ahead, Mungabo.
Okay, good afternoon, everyone. In response to Moses' comment, so for example, the challenge had been observed. So they had observed that in Zambia, I come from Zambia. So in Zambia, when it comes to the non-technical staff, so we're looking at people who work in procurement, people who work in accounting, people who are human resource managers within the health system, what was agreed upon was to provide training for them. So this very course actually, initially, us clinicians are only now finding out about this course, but about 2 or 3 years prior, actually I think 2 years prior, all the non-technical staff were encouraged to take up this course in an effort to make them more aware of the broader aspects of the health system and where they came in, and also to just give them a certain form of awareness around health-related financing, health-related human resource procurement, and so on and so forth. The only issue that I'm finding, because for example, the facility at which I'm at, I think about 6 people initially signed up, I think last year, but when I was inquiring, none of them seems to have finished this course. And I don't think this course is spectacularly involving or challenging. So I went around and I asked them, but why didn't you finish? Some people said, oh, there were incentives initially. They gave them tablets, they were giving them stipends to help with data, and so on and so forth. But there was just no follow through. No one monitored the progress of the course. No one monitored attendance. No one evaluated how the course had gone, whether people's attitudes had changed. I don't even think anyone followed up to see who had actually completed the course, if anyone got their certification, and how they found the course. So you find, so for like Ministry of Health Zambia, they tried, they had a really good idea, but no one audited the training. And there were so many challenges. Some people just weren't that interested. Some people just didn't see the need to follow through. Some said they were really busy. But I think, and I don't think Zambia is the only one. I'm sure other countries probably are trying to do something similar, but then there will always be a few challenges. So I think this was like a good attempt, although it needs to be polished up.
Yes, thank you very much, Mungabo, for that. So right now I'm going to place us into breakout groups. You know how our session goes. So we have a case study. Just what you will do when you get to your groups, select someone to be your facilitator and someone else maybe to be secretary so that they can write down what you discuss, go through the case, then using the concepts that you have learned in module 5, the HR principles that you've mentioned today and others more, just answer the discussion questions. And then after about 40 minutes, we will come back to plenary, and then each group will present what they have discussed. So I have put up the document on the chat, the case. So right now I am going to put us into breakout sessions. And then at the end, when we're doing plenary, we'll also have more time for people to comment. So just give me a minute to send you to the groups. Any question before I send you to the groups regarding the group discussion? And someone is saying the doc is not opening. I'll try and send it again. Anyone else? Has anyone else tried to open the document? Are you able to open it? Anyone else having issues? Okay, documents?
Yeah, it's
Well,
not opening. It's not opening.
I have
think
an
it
issue.
has
It
to
is
do
not
with the
opening.
file.
Okay,
It's not
all right.
opening. I think it has to do with the file.
All right, okay.
Because the
Let
file
me,
is not showing as a PDF document at all.
all right, let me just send you the document again. Give me a minute. Mm. I can see what the issue is. All right. Just 1 minute. Just try it again and let me know.
Yeah, hello. I'm just joining the group now. I'm just joining now, so I'm not yet in any group.
No, I've not
Please.
yet put you in groups. I wanted to make sure the document can open before we go to groups. Just try and open the case study again. I've put it up. Open it and let me know if it's opening.
Mine can't open, please.
Anyone else? I don't know why it's not opening. It's opening on my side.
It is opening on my end also.
Marianne, it's opening.
Yes,
Is
it
it
is
opening
opening
for
on my
Marianne.
Do you have it as a PowerPoint Microsoft Word?
I can switch it to Microsoft Word and send it, but I think it's opening for some people. Probably it's it could be your application, but let me also send it as a Word document. In the meantime, let me send you to your group so that you can start introducing each other and selecting your facilitator as I send you the case study. Is that all right? Just sending you now. Okay, you can just go to your groups. I'll put the document in the chat. Hello, are you unable to join the group? Those who are still in the main room. Have you been able to join our room? Let's see. Sorry, hello? Hello? Martin, are you unable to join a group? Maybe I can assign you to a room.
I've been joining, but my internet.
Oh, it's all right. Bambangatu, in which group were you? I can put you back in your room if you had a problem with your internet. Martin, in which room were you?
I don't know. You can just slot me in any group. I'm
In
Bambang.
any group. All right.
Yes.
Okay. No worries.
Mm.
Hello, Mercy.
Hello, how are you? Funmilola, what
Hello,
happened?
hello. Good afternoon.
Good afternoon. I looked for
Thank
you when
you.
you were starting. I couldn't find you.
Yeah, it's my system that is malfunctioning, so I have to use my phone to start all over again.
All right. Okay, no worries. I'll just put you in a group for discussion.
All right.
Thank you for joining. Yes, thank you.
Thank you. Yes.
Okay, hello, Mercy. Hello, Mercy.
Yeah.
Hi, Lisette and Bello and Yaya. Are you just joining the meeting?
Yes, sorry for being a bit late.
No, no worries. I just wanted to catch you up on what we have done so far. So, today we are discussing module 5, which is human resources for health. So we have already had the discussion and gone through a few of the principles that were presented in the module from unit 1 to unit 6. And so right now people are in breakout groups. There's a case that you'll find them discussing. So I'm just going to send you to the groups. So they'll be discussing a case that has to do with human resources and how to deal with the problems in that case. Okay?
Okay, thanks. Yes.
All right,
thank
let
you.
me send you to the groups. Hello, everyone. Welcome back to the plenary session. Let's just give the rest of the groups time to wrap up, and then they'll join us. Hello, everyone. I believe everyone has joined us back from the breakout rooms, and I hope you had enough time for your discussions. I know there were some groups which were still going on, but the thing is this discussion will never, it's usually one that will never end. So for the groups room 1 to room 6, if you are the one who is going to present for your group, please raise your hand so that I can note you. And then for anyone who needs French interpretation is still available. Alex is here, our interpreter. So just go to the bottom of your screen, click interpretation, and then click the language that you want to be interpreted into, whether it's French or English, depending on your needs. So I have 3 hands up. Let me see more. 4. That's 4. 2 more groups. Okay, so I'm just going to start in order of my screen. So I'm going to read out your names and I'll tell you the order in which you will present. We have Mungabo, we have Margaret, we have Maboy, we have Uzodinma, we have Ruby. So I'm going to start with Mungabo. Just introduce yourself and which room you're presenting, and then present your discussion points. Go ahead, Mungabo.
Thank you. My name is Mungabo Chongo. I'm a medical doctor from Northern Zambia. I am presenting for room 5. Right, so we had an entire host of challenges. I think to give space for everyone else, maybe I'll just do 3 for now. Then maybe we can come back if the others miss. So the first challenge that we had is we had high patients to staff ratio. The context being it's a 200-bed capacity district hospital with only 2 doctors, 2 clinical officers, and 1 nurse at the time. And I'm going to couple questions 1 and 2 together. So that was the challenge. So for question 2, what we were thinking is if we're a district health director, what we'd want to do is take advantage of the WISN and be sure that we actually know the numbers of staff that we need in the facility and how to distribute them. We said also in regards to speaking to this high patient to staff ratio, we said, well, we elicited that sometimes some of these district hospitals might actually also have a high burden of clients because the other smaller facilities might not be doing their jobs, right? So at the context of being a district health manager, you don't just have a district health office, a district hospital. You also have other smaller facilities. So we want to also encourage everyone from all the facilities to do their role, see their clients, so that we also reduce the burden at the main district hospital. We also talked about a little bit about retention. So if we keep losing staff, we'll always have a high burden, a high patient to staff ratio. So we also said as a district health director or as human resource at district level, you want to ensure that you plan financially well in advance so that you can actually have an action plan ready. You know how much you need so that you never come into the situation that they're in now, where they don't have money and people are frustrated and flustered. Also, in regards to retention and us trying to reduce the burden, we also said there are also non-financial things that we can do. We ensure that there's proper communication. We allow people to understand the situation. Sometimes if you just don't have money, your country doesn't have money, the Ministry of Health doesn't have money, if the staff really understands what you're trying to get across, and if you're open to them and you explain to them the reality of the situation, as we can see here, we have a lot of young staff and they really want these jobs. But instead of letting them burn out and letting them get frustrated, if we are open with them, explain the financial situation, explain where we're at, we might actually help with retention going forward. Because, the other challenge that was there is we noted that most of the staff had very little experience. And one of the solutions to this was we were saying, in the event of advertising for new roles, like we understand most public hospitals have to employ newly deployed people who've just come out of school. But that doesn't necessarily have to be the case. Like, yes, the majority can be new, but you can also advertise for in-service nursing staff or whatever type of health staff that have some experience, so that when you have a situation like this, you don't just have new people. We also noted that if we have human resource policy documents that explain exclusively that we need job induction training for specified durations, we'd have a situation where before someone was allowed to work on their own, they would have been thoroughly inducted and they'd know what they needed to do. What comes to mind is for the NHS in the UK, if they're going to employ you, especially if you haven't been in clinical work for a while, they let you do tests, you do some clinical skills, you do some online tests for up to 2 months before you actually show up in a hospital, irrespective of how much prior experience you have, just so that you get caught up on what you're expected to know and what you're expected to do. So we also thought of that. Yeah, I think maybe we have quite a lot, but maybe we'll allow other people to say something as well.
Thank you so much, Mungabo from Room 5, for those great insights. I like how you thought about not only the hospital and what it's facing, but the hospital as a system within a system, because you thought of hospitals around and how they can relieve and what a district health manager can do in terms of planning to help that. So now we'll move on to Maboy Amos.
All right. Hello.
Hello. Go ahead.
Yes, I believe that I'm audible. I'm Amos Tongwani. I'm a registrar in family medicine in Sefako Makgato, that is in Pretoria, South Africa. I'm going to discuss a patient that is not a patient, sorry, a new employee in a district health center that was not, let me say the objectives first that I'm going to discuss. She was not orientated, there was lack of support, and she had no knowledge of using the equipment to take vital signs. So she just wrote from her mind, then she will say your blood pressure is 120 over 180 without necessarily taking the blood pressure, and there was no support from the manager of the facility. So they were not working as a team with the manager. So there was lack of support thereof. And then as a result of that, she ended up being frustrated. And as a result of the frustration, the treatment to the patient was not good. And she was often intimidated by the manager. So on that note, so I thought that it is important that at facilities we organize in-service training so that if we hire somebody with lack of knowledge or straight from school just completed their courses, we need to take them for in-service training so that they are well equipped with skills to deal with patients and to deal with the work that they are facing. And also to deal with the manager so that there's no subordination, so that they work together. And the communication thereof, it must be good, not the communication breakdown. So that's what we have come up with. Then as a result of the communication breakdown, there was poor performance regarding the work that she has to do, and there was also lack of motivation. If I left something, I would allow my team to add on the things that I would have left out. Thank you.
Thank you very much, Amos. Anyone from the group would like to say something? I'm not seeing any new hands. Thank you so much, room 3, for that. You're really focused especially on the issues of induction, orientation, motivation, which are actually very important to maintaining your workforce. So we are going to move to Uzodinma. Dr. Uzodinma, are you there?
Yes, I'm here. I would like to share my screen now.
Okay, all right. Give me a minute. Let me allow you to share your screen. Oh, there.
Am I there?
Yes.
Okay. So our group is made up of very great people, committed, including Shaibu, Caring Spirit, Lillian, Fatma, Alex, who breathes in from time to time to check whether we need French interpretation, and myself. We had 2 questions to address. My name is Dr. Uzodinma Adrieje. I am participating from Nigeria. It says, identify the human resource challenges, problems, and gaps. Our group came up, identified shortage of health workers, poor capacity among some of the workers, lack of mentorship, poor communication among the staff, poor remuneration for the staff. There is element of staff attrition, and staff retention has become a problem. Then when pension became an issue, unsure of pension, workers went on strike. So we saw pension also as a challenge, a problem. And then failure of human resource management, including risk management. These were the things we found identified as the human resource for health challenges, problems, and gaps. We discussed, and we felt that in order to address this problem, if we were the district health manager or director, we will consider doing one, more, or all of the following. Provide orientation and hands-on training to Lucy and the other staff, including mentorship and support. Build staff confidence, especially encourage them to ask questions and be ready as senior managers and officers to provide guiding responses and answers. Institute task shifting to see whether some people can become more useful at certain times. Recruit more staff, doctors, nurses, and support staff, because even the checking of the BP, somebody else can be doing it and be taking measurement while the nurse does something else with small training. Now, provide clear job description. institute morale booster for staff, like having a nurse of the month, doctor of the month, cleaner of the month, a record keeper of the month, and so on. Integrate or reinforce education programs into the trainings, including communication, ethics, and so on. Provide capacity development and on-the-job trainings for people in form of education and training, because the two are different, especially as we heard. Then have and follow a resource mobilization plan that is focused on funding and provision of service, so that if there are people that can provide services in kind, then we can recruit them, such as engaging volunteers who are retired health workers, but are able and ready to offer services in an affordable manner or without even asking for any money. Then consider instituting outreach services to reduce patient load on the hospital. There are some cases that if there is an outreach, they may not really require the patients coming to the hospital. Thank you. These were our thoughts submitted for your consideration.
Thank you so much, Dr. Uzodinma. It has been, this is quite clear and concise, and I thank you because you have thought about a lot of issues, especially the issues of a reward system, the issue of another way of remuneration other than money. And I think those are important concepts to think about, especially nowadays when it comes to motivating of staff. So next we are going to have Ruby.
Hello, good afternoon. My name is Ruby Kodom from Ghana. So I am representing group 2. Okay, so we were presented with a case on human resource management, and in answer to the first question, some of the problems, challenges, and gaps that we identified include the poor working conditions that the staff had to endure, and so the heavy workload. So you had on average a daily record of 150 outpatient visits to the hospital, and the doctor and nurse to patient ratio was low, and so this impacted on the staff attitude. The staff also felt that their welfare was not being considered, and so motivation was low, and staff or worker retention was also affected. And that culminated in a strike, which resulted in the management hurriedly recruiting a fresh out of school graduate nurse. So low staff strength, job security was in question, because if management is not interested in staff welfare, staff development, then people don't feel secure in their jobs. Remuneration also was poor, and so they were looking for the cheapest option when it comes to human resource, and then putting them to work in unfriendly or unfavorable conditions. There was no orientation, or even if there was, it was minimal. So there was no training. There was obviously no HR planning in place or manual in place. So one nurse managing 150 patients on average, the hospital did not have the interest of their workers at heart. Now, to answer the second question about how to address these challenges as a district officer or manager, we were of the view that the pay structure must be addressed and rationalized, because people must be rewarded for the jobs they do. And looking at the flow of patients to that hospital, there is a need for more clinics within the district, because it appears, sorry, forgive me, it appears that there are not enough health facilities in the area, and so all community members seem to visit or have no option but to come to this facility. We also saw that the management could employ a more participatory approach in planning and managing the hospital. And so management by objectives as an approach would be useful, where objectives are defined in a participatory manner. So where both management and representative of the employees are on board, and then they set clear, achievable objectives. And then these objectives are also communicated to employees. There should be transparency in how performance is monitored, and progress should be evaluated so that achievements are rewarded accordingly and staff are motivated. There should be continuous professional development. We also identify the need for succession planning, so that the challenge that arose because a lot of workers were going on pension and there was no pension package, which led to the strike, meant that the facility or the hospital did not have a plan in place. So succession, HR succession planning would be useful to manage retirement and to also manage new recruitments for vacant positions that come about. So I think, I hope I've not left anything out, but if I have any member from Group 2 can add. I'm sorry for the interruption from my little one. So thank you.
It's all right, Ruby.
Okay.
We welcome the new participant in the leadership and management course. It's never too early to start. So thank you so much for bringing the concept of succession planning and also management by objectives into your solution, because those are two concepts that are normally left out when it comes to HRH. So thank you for that, Room 2. We'll move on to Robert. And if there's anything that the other rooms have mentioned, you can leave it out because of time, because we need to start wrapping up. Over to you, Robert.
Okay, thank you. It's Robert from South Africa. I am representing Group 3. I think from the gaps, problems, challenges that we have identified, it is more on the strike. There is a strike due to poor working conditions, long hours, and low staff morale. And then there is also a shortage of staff. There is also interference of the benefits. That is one of the reasons why they are the benefits in terms of their pensioners, one of the causes of the strike. And another problem identified is inductions programs to the newly staff, and also the professional support from older staff to the new staff when they need to a mentorship program. Now, how do we solve those issues? We suggested that no, we need to have a proper inductions program, including the on the job, like looking on Lucy, that Lucy, she's newly qualified. She has been thrown into the deep end. She's working at the triage. Once you work at the triage should be managed by somebody who's well experienced to be able to refer and direct the patients where they're supposed to go. So that is one of the problem solving, that we need to have a proper inductions programs on the job and continuously. And then we also need to reassure Lucy that she's still new, that she needs some mentorship programs to work with somebody. Like we identified that the older nurse was not supportive, was shouting at her, reminding what she's too old and all those things. And she's not even familiar with the equipment. Then another issue that we need to address here was to address the community. To say, because when you look at it, we are saying it's 150 minimum, it's 150 patients per day. So if we can readdress the community, that because we are having a strike, so our queue management, it is not well managed. So we try to involve community to use the other available nearest facility where they can go and then access their services. So when you're addressing these to use the nearest facility, it also enter into the referral system. If the referral system from the clinic to the community health center, then to the district health hospital, if the referral system is well functional, then we wouldn't be having all these overpopulated patients who will come to the district hospital, because some of the conditions, it can be addressed by the primary healthcare nurses at the clinic facility. And then if they cannot manage it, they need to send it to the community health center where you will get a doctor also there. Then if those healthcare center cannot manage that particular patients, that's when now you need to refer to the district hospital. So there is a need to improve the referral system. And that referral system, it must include the utilizations of the facility by the patients themselves. Also, you need to address the issue of staff, the strike. As a director from the district, you need to address their concern to say their patients that they are going to be interfered, poor conditions, long hours, overworking. Then you need to involve their union and sit down with them and address their concern and promise them, come with a plan that it will actually allay their anxiety to their workers to say in 2 months or in 3 months time, we will come back and to address your issues, even if they may not short solutions like money. Money, it involves the Ministry of Finance and all those things, but at least communicate with them, acknowledge their issues, and then come out with the plans to address them so that when they come back to work, everybody is happy, and then they will be able to work happy, address their unhappiness. Then the other one is to deal with the queue management. The queue management, it goes hand in hand with the triage. So if there is no queue management, you may not be able to deal with these issues. Like the waiting time period, it should not be more than 6 hours. Once the patients enter into the facility until the patients get the medications and get out. So if the queue management, if you have got a proper system, it should be able to be managed. But here, there is a shortage of staff, that it might not be possible that patients, when it comes from the entrance until the exit, will spend up 6 hours. So is to make sure that we get enough staff. And then if enough staff, they're not there, then we need to redirect these patients to utilize their first level of care, which is the clinic. And then if it is not well managed, then they will go up to the district level. So the services that are provided to the district level, it should be that they could not be managed at the clinic and the community healthcare centers. My colleagues, if I miss something, you're welcome to add. Thank you.
Thank you so much, Robert and group, for that very concise and detailed analysis of the case. I like the fact that you brought the strike to the forefront, because the reason for the strike being in the case was strikes are becoming a major issue in most healthcare systems. I don't know about your countries, but here in Kenya, it's a major issue. And anyone who is leading and managing within the healthcare sector needs to know how to, one, prevent, and if it so happens, how do you deal with it? Let's move to the last but not least group. Margaret.
Okay, thank you, Mercy. For me, majority of what we had has been said, but I have 1 or 2 points to add. For the challenges, as you have said, the strike was the main issue here. So there was poor conflict resolution strategies that failed to address the challenges that the nurses were having, and thus they went for strike. So for the Director of Health, I would provide a good way to solve these conflicts, come up with a good conflict resolution strategy, well stipulated, and also come up with a clear-cut policy on human resource functions such as staff recruitment and selection, induction, and retention and remuneration. Also, we would introduce performance appraisal, where each employee will have targets, and you can even come up with a incentives such as employee of the month, so that each and every person will be in a position to feel like they want to up their game. So I think the issue here is to improve the working condition and to motivate the human resource, so that at the end of it, the patient cannot suffer by now employing nurses who are just willing to get a job, and they are not well equipped with the knowledge and skills, but they have no other ways because the mentors are out because of a strike. Yeah, that is what I can add, Mercy.
Thank you so much, Margaret and group. Let us all give ourselves a round of applause for the good work that you have done on a Tuesday afternoon. I am so glad and happy to always see you going through the course, coming and having this case discussion. So thank you so much, everybody, for showing up again today. Mine is just to, in summary, remind us of the concepts that we have been learning during this session, because the most important thing with this course is that it becomes applicable to you in your settings. That is why we use case analysis as a method for discussion. When we come here, all of us, and we have a case that we have a problem that we need to solve, are we able to apply what we have learned to solve that case? Are we able to apply the principles and the tools that we have learned to solve that case? That is the important thing when it comes to case analysis and also participation and putting our heads together. Because in the real world, when you go back to your places of work, what matters is, I have learned about performance management. I have learned about management by objectives. Am I able to do it with my current staff as it is now? With the strike, why did it happen in the first place? What were the missteps? You know, how could we have done it better, or what can we do better? Because people don't just wake up one morning and go on strike. It is something that builds up over time. And I think you have spoken to that in terms of this has been happening, and they failed to have an HR strategy in place, HR planning in place. They failed to have reward systems, performance appraisal systems in place that eventually led to the problems that they're having now. We are 8 minutes over time, and I have the presentations will be sent to the Google group. The PowerPoint presentation and also the case study will be sent to the Google group. So we'll take your emails and send them to the Google group. As we are wrapping up, and I'd like Francois, who is the Deputy President of Afro PHC, to wrap up for us. I'd like everyone to put in the chat one concept that you have learned from this module and this case study and the discussion from all your colleagues, just one concept that you have learned that you are going to apply. Just type in the chat, whether it's management by objectives or performance management or risk management, anything that you have learned that you think is relevant to you that you're going to apply. So just put it in the chat, and then we'll put it all together somewhere and post in the Google group. So Francois.
Yeah, Dr. Mercy, thank you very much. Good afternoon again, everyone. And I want to sincerely thank you for your attendance to our leadership management and governance Module 5 session, and the rich contribution in sharing from the different group members. Actually, I learned a lot. I hope you too did. And we are looking onto you for our Module 6, which will be next month, and hope to be with you again next month. Thank you for attending, and do have a nice time. Bye-bye.
Thank you, Francois. Bye-bye, everyone. Before you go off, please do type in the chat one thing that you've learned and one thing that you're going to apply. We're going to put it all together and post it in the Google group. So just keep typing it in the chat as you go. So thank you so much. Hopefully next time we'll have more time for discussion. And please, for those who had not gone through the course, please keep going. We are hoping that all of us, 60+ people, will be graduating and getting a certificate at the end of the year.
Thank you. Good day. Goodbye.
Bye-bye, everyone. Thank you.
Bye-bye.
Bye.
Bye.
Bye-bye.
Bye.
Bye-bye.
Mercy, how are you? It's been wonderful. Thank you for facilitating.
Thank you also for joining and for making the discussion so rich. I hope to see you for module 6.
Yeah. By the way, I'm in Kenya right now. So
We're in Kenya. We should have coffee.
I think so. Let me check the name of the hotel where I am. Hold up. It's very cold. It's a bad. Oh my! Nobody told me Nairobi is this cold. Parasina. Parasina is closer to the State House, somewhere closer. Parasina.
Oh, okay. Just DM me right now your number, the number you're using.
Okay, let me do that.
All right.
Okay.
I
I also saw Connie. You know Connie? Yeah, she was part of us. The first. I was asking her why she has not attended today's training, but she attended 1 or 2 of the first one.
Order.
Yeah.
Yes, I do know her. Yeah, she's a colleague.
Yeah. Let me send you my number right now.
All right.
Just keep
Mercy and team, thank you so much.
Thank you so much too. Thank you for joining, and all the best with the course.
Thank you so much.
Have you seen it?
Yes, I have.
Great. Yeah. Please come say hello.
All right. I will.
Thank you so much. It's been wonderful. Thank you. And
Thank
I
you
love
too.
your leadership. I think we need to stage a coup. The professor were taking over. Young people are taking over.
I will let him know. I hope we are still not recording.
Yes, I love the mentorship really, because this is what it means to have the mentorship and create